Welcome back, listeners. I'm Robin Black, and this is It's All About Healing podcast. We have a very special guest with us, my cousin, Nikki Rowan. She's an OB-GYN, and today we're going to be speaking about gynecology, pregnancy, menopause, and hormones. But first, Nikki, tell us a little bit about yourself.
I don't know where to start. I grew up, I guess, in Milwaukee and went to school in Rhode Island and then worked primarily in Florida. I did my residency there, stayed on in essentially private practice for like 20 years or so. And just recently have been transitioning to doing travel medicine. So I'm getting to go around the country and do a few days here, a few days there
Oh,
in
wow.
order to keep my bills paid, but also, with the current political climate, practicing in Florida has been a little difficult. So,
Wow. Okay. And so, what originally first got you wanting to go into the medical field?
um, I think I was a little bit of I don't know, uh, I don't know what the right word is, but I was a little bit, I didn't like to be told what to do. And I think originally, um, it was more so that my teachers didn't really have much expectation of me, I think, and didn't think that I could do things like this. And so I was really just doing it to make them mad in the
Yeah.
beginning.
Uh-huh.
And then I guess it probably realistically was a greater plan,
Mhm.
that I didn't see at the time, but that fortunately pushed me to do something that I really love doing, and I can't imagine doing something different.
Wow. And so, how long have you been an OB-GYN now?
I finished residency almost 20 years ago. So,
Oh my goodness.
yeah.
I'm sure you've seen some things. So,
Yes.
and as far as being a travel OB-GYN, like what does that consist of?
So I contract out to different locations,
Mhm.
and I agree to do a certain amount of time. So it's not like a full-time job basically, and I'm just filling in, for, let's say, a doctor needs to go on maternity leave, um, or if they have some vacancies, they have more demand than they have doctors, but are having trouble hiring somebody permanently, then I
Okay.
can kind of fill the gap while they're doing their real search. Um,
Okay. Okay.
yeah.
And is there an allotted time that you're supposed to be there, or can it just kind of differ once you arrive?
It differs depending on what kind of contract you set up. So currently I have a contract in Indianapolis, and I told them I'll do 4 days every month. And I have another one in Wisconsin that's also 4 days a month.
Mhm.
Um, and the rest of the time I'm off,
Yeah.
which I've been enjoying. So
Yes. And when you're off, are you back in Florida or are you just traveling where you would like to go?
I've been, in Florida some, and then I have been doing some travel around
Yep.
the world.
I know. I see the pictures. You've been everywhere. That is so amazing. Gosh, that is
Yes,
amazing to
it's
do.
been very fun.
Yeah.
So,
What's the place that you've enjoyed the most so far?
I am surprised to say this because I was not looking forward to going, but Japan
Uh-huh.
has hands down been my favorite.
Yeah.
I did it just because that's where the kids wanted to go, and I was dreading it, but
Yeah.
I loved it so much that I already booked to go back by myself
Really?
without them.
Yes. When are you going back?
I'm going to go in November.
Oh, that is so exciting. Which part of Japan?
This time I'm mostly just going to stay in Tokyo. I might do a day trip to the mountains or something, but the kids weren't really into shopping or, you
Yeah.
know, some of the more adult stuff. So I'm like, let me just go and redo this for me.
Right. That I get. I definitely understand that. So, with some of the questions, as far as this women. We
Okay.
are all over the kind of we're all over the board, but
Yes.
I guess a lot of the questions that I want to know is kind of about our hormone imbalance. Like, what can cause a lot of it? Is it age? Is it medication? Like, what can it be? Because I realize the older I'm getting, especially now
Mm-hmm.
that I'm entering in my 40s,
Mm-hmm.
definitely have some days where are a little questionable. So that's
Yeah.
kind of what I want to start off with is hormones.
Okay. Well, I think it's very complicated. There definitely, you know, we all have lots of hormones, some of which are kind of considered female hormones. And the the way they function in our body is a lot like a symphony with a lot of different instruments playing.
Okay.
And so um, just like with a symphony, each one of those instruments or each one of our hormones has a separate part to play, and it needs to be done precisely. And if it doesn't, if each one of those parts is not doing what it's supposed to do, it can kind of mess up the entire final product. And so um, it is definitely very easy to have things kind of be a little bit off, because there are so many different things involved that interact with each other. And, one thing being off will change the entire interaction.
Okay.
But I think it's also, you know, a lot of times people will think that they want to get hormone levels checked, and it may not necessarily be super helpful. Um, Certainly, there are some people who things are just extremely off,
Yeah.
and for them, checking the levels probably is helpful to figure out what that is. But the vast majority of people that we check levels on, the levels are technically normal
Okay.
because the range of normal is huge, you
Yeah.
know? And so, and there's supposed to be a lot of variation in your levels. So the hormone, if we're looking at estrogen, for example,
Yeah.
the level of estrogen that I have needs to be different during different times of day,
Okay.
during different times of month, and so when we check, it's really hard to say for that particular moment in time,
Mhm.
was it right or was it off, you
Right.
know?
And
And as
so,
long as it's in the ballpark, we say, well, it's normal.
yeah. So, does that have a lot to do with that? Could that kind of go for the mood swings that we go through, or is that totally different?
It could maybe contribute a little bit to mood swings. Definitely there's more fluctuation in hormones, like at the age of puberty and
Mhm.
also perimenopausally.
Yeah.
Whereas in between, like let's say in your 20s and 30s, your fluctuation is a little more fine tuned. But when you're in puberty and your body's just trying to get adjusted, the hormones fluctuate a lot. And then also by the time of perimenopause, your body's kind of just struggling to keep it together, and it overshoots or undershoots a lot.
Right.
And so that kind of tracks for why those are some of the moodiest times of life also. But if you think about it, in puberty you have skin changes and smelly sweat and
Yeah.
um super sleepy all the time and moody and a lot of those very similar breast tenderness,
Yeah.
more cramping with your
Mhm.
periods, a lot of those symptoms that happen in the early teen years are reoccurring again as you get closer to menopause.
That makes a lot of sense now that I think about it, because I
Yeah.
know with me it's a little bit different because, I mean, this might be sharing a lot, but I had an
Uh-huh.
abortion right
Uh-huh.
after I had weight loss surgery.
Uh-huh.
Everything came back. How does that even happen? Like, do you know that?
So, ablation is just a physical. management of bleeding.
Hmm.
And so sometimes for women that have that done very young, sometimes it's just not going to last, you know.
Okay. Okay.
Um, and so, if you have a woman who gets it when she's 45, it will almost certainly last her till menopause. If you have a woman who gets it at age 30, it's probably not going to last till menopause.
Okay.
Another thing is that a lot of times weight can change the way your hormones are and affect your periods. And frequently will make you maybe go longer stretches without periods, but then when they do come, can tend to be very long, very heavy.
Mhm.
And so it's possible that, you know, if you had a break of bleeding after the ablation, then it could have been partially due to the ablation and partially due to, not ovulating regularly with weight. And then when your weight comes down, your hormones start to regulate a little more and have more predictability where you would have more frequent periods.
Oh, okay. That makes a lot of sense. Gosh, the woman
Yeah.
body is so difficult. So,
Which
um,
is why, if you think about it, a lot of times, so when you're heavier, that can interrupt ovulation. And ideally, in a perfect world, people would ovulate once a month.
right.
Um, but a lot of times when you're heavier, maybe you only, instead of every 28 days, maybe you ovulate every 35 days. Maybe some people might only ovulate twice a year when they're heavier. But when you start losing weight, it doesn't even have to be like a dramatic amount of weight necessarily. Usually, like maybe 10% of your body weight or
Mhm.
so will wake your ovaries up and make them ovulate more regularly. And so it's like the classic story of people buckling down, diet, exercise, just start losing weight, drop down a size of clothes, and boom, pregnant. It's
Right.
because you're ovulating. You were able to maybe be a little bit less on top of birth control
Yeah.
things when you weren't ovulating frequently, but when you start ovulating regularly, it catches you off guard.
Yeah.
And next thing you know, you're pregnant. Now you're gaining pregnancy weight.
Oh, no.
That
Yeah.
happens to people all the time.
Yeah. No,
So,
no, thank you for that one. So, as far as menopause or perimenopause, should I say,
yeah.
and those symptoms, like I know incontinence is a really big one that a lot of women are struggling with.
Mhm.
What is the best way? I mean, I know that there's medication out there, but the ones who just kind of are struggling with it, with the medication and without the
Mhm.
medication, what are some things that they can do for that?
So there are lots of different types of incontinence.
Okay.
And depending upon what type you have, kind of determines whether it will respond best to medication or to, physical therapy or to the surgical repairs.
Mhm.
Um, but I think it's very common. Most people that are having, I shouldn't, maybe most is not fair, but lots of people who are having incontinence have at least a portion of what's called stress incontinence, which has to do with how strong the muscles of the pelvic floor are. And, so this is the type of incontinence that happens when you cough, laugh, sneeze,
Okay.
bounce, where you're fine if everything is,
Yeah.
sitting and nothing crazy is happening. But then when your muscles have to hold the urine despite increasing pressure from
Mhm.
whatever you're doing, they're just not strong enough to hold the urine in.
Okay.
Um, and that responds extremely well to physical therapy. There probably is a little bit of an age component to it, just the same way a lot of our muscles
Yeah.
don't work quite as well as they used to as we
Yeah.
get older. Um, but I think what we're learning, is that a lot of women really start experiencing it much younger than we ever thought. I think people used to have shame,
Mhm.
around it and didn't want to talk about it and kind of hid it. Um, And so people really had no idea how common it really is.
Okay. And I mean, so what is, do you know what the physical therapy consists of for like what?
Uh-huh. So ideally, you would go to like a physical therapist who specializes in
Okay.
the pelvic floor
Okay.
because, you want an expert,
Right.
basically.
Yeah.
You
Yeah.
don't want the same person that's going to help your wrist get better to be, you know,
Yeah.
playing around in your vagina.
Yeah.
So, um, and you do, you know, some of this is kind of, it's sensitive tissue, and, there is a little bit of kind of embarrassment, or, you want to feel comfortable with who you're with, and you're more likely to feel comfortable if this is what they're doing all day, every day, because they're getting the practice in to kind of learn how to bring up certain subjects without making you feel bad, or, that sort of thing. So I think that's important. And there are now actual fellowships for specifically physical therapists who want to do pelvic floor stuff.
Okay.
Um, and so when you go see them, usually they do like an initial assessment that does involve physical exam. So they, just similar to if you were at a GYN appointment, they are going to do an internal exam with their fingers to kind of assess, strength of certain muscle groups, and if you're having any tenderness or pain. Sometimes people will have like spasms down there that can be painful, and they can really help a lot with trying to retrain those muscles to relax.
Yeah.
Um, and then once they kind of figure out where you're starting from, then they will, um, usually they have like these little electrode things that look kind of like, I don't know, a dildo essentially, that you put, it's attached to wires so it can sense pressure.
Okay.
And so you put that in, and they'll tell you to do certain things, hold a contraction for a certain amount of time,
Right.
be in different positions and contract those muscles. And then they're able to see a readout on the computer of exactly how well you're doing, and what, they can kind of coach you through a little bit more meaningfully how to actually, like change this, try to breathe like this and do it and see if that helps. And then when they catch you doing it right, then you get immediate feedback, like that's what we need you to do, keep doing that. And
Yeah.
then they'll give you certain exercises to practice at home.
Hmm.
um and it's I've seen patients have really pretty dramatic improvement doing it. And I've had incontinence for a very long time that I was just living with. And when I took some time off before transitioning into this travel stuff. And over the summer, I did physical therapy myself. And
Yeah.
it was like a very big difference.
Okay. Okay.
Very, very big. And it was, I want to say, I mean, I think I was going for like, I think those sessions, I can't remember if they were maybe 45 minutes long or something. And I was going, I think I did maybe once a week for 6 weeks or something like that. And
Okay.
then, she had me doing homework, and I would say it was maybe, if I was really doing it right, probably like 20 minutes a day or something
Okay.
at home that I was doing. But it was, it made me feel like I cannot believe I waited this long, like,
Yeah.
why did I not prioritize this before?
And how long did it take for you to start noticing a difference? Did it take the same?
I would say, I mean, I was kind of skeptical. I'm a hard judge.
Yeah.
So I didn't really want to, I was like, well, but you know, I wasn't drinking as much, so maybe that's why I wasn't leaking.
Yeah.
Or maybe I was home, so it wasn't, it wasn't like I was up on my feet all day, or,
Yeah.
like I was coming up with all these reasons for why, why are my underwear dry
Yeah.
now? And finally, I mean, it was probably a few weeks, maybe 3 or 4 weeks before I started really being like, okay, this is actually real.
Okay.
And yeah,
Okay.
I didn't believe it. It's embarrassing because I feel like, I try to convince people to do it all the time. But
Yeah.
even when it was myself, I was like, I
Yeah.
don't know.
That is interesting.
Uh,
Okay, I gotta
yes.
definitely keep that in mind. And as far as I guess we could just kind of switch gears here, but I do want to get on the topic of pregnancies,
Sure.
but I would also like to know what has been like your most just intense story of being an OBGYN.
I don't know. There's so many stories, so many different kinds of things. I don't know. You got to give me a more specific question. There's no
Well,
way I could narrow it down.
I would
Okay.
say, let's see, like a birth story, like an amazing birth story.
Um, okay. I am not a very natural person. Like I like interventions. I
Yeah.
like control. I like medicine. I
Mhm.
like, I like all the things.
Yeah.
And so, but I had this one patient one time who well, I had gotten introduced to hypnobirthing by another patient, and it had worked really well with her. And so I started recommending it to people who were trying to labor naturally without an epidural.
Okay.
Um, and it definitely um, is legit, like it actually works. But I recommended it to this one patient, and um, she ended up needing an induction, which makes it a little bit harder to go natural because inductions take longer,
Yeah. Mhm.
patience runs out. So we were having to induce, and she was a little bit nervous, but she got in her zone and was doing hypnobirthing is like, you know, you kind of prepare ahead of time with certain phrases that are gonna trigger you to be really calm and
What? Okay.
controlled and stuff. So she got in her zone and started doing it, and everything was going really well. And then, I was in Florida, so um there was I don't know, do you guys know what water spouts are? It
Uh,
kind of looks like a tornado,
uh-huh.
but it's on the water.
Oh, yes.
And
Okay. Yeah.
you don't really know for sure when you see it. Is it a tornado? Is it
Right.
a hurricane? Like what's happening, but you just see this thing twisting around, right? And so there had been like one-sided or whatever, and so the hospital is going into like their emergency mode, and so they're having us move all of the patients away from windows, and like we have to physically relocate everybody.
Yeah.
So we're moving her bed while she's laboring, and like trying to hope, are we, is it about to be a hurricane, what's happening? And she was like, through all that chaos, so calm and
Uh-huh.
together, and never, just really focused. And she ended up delivering like a 9.5 pound baby
Ooh.
in a position that was probably made it feel even bigger than that to her pelvis.
Yeah.
And she ended up having a postpartum hemorrhage, and we have to do all sorts of stuff to fix that. She did it like so poised and calmly, and
Yeah.
it was just amazing. Like it just gave me goosebumps
Yeah.
how she did the entire delivery. I was so
Yeah.
impressed. Um, but it's kind of cool sometimes, like I see labor all the time, and it is a miracle every time, but some of them just make you feel like, oh my gosh, this was really unbelievable what she
Yeah.
just did, and that
Wow.
was one of those times.
I never heard of hypno. What was it called?
Hypnobirthing, like hypnotizing, but
Yes. And they do it themselves. They're just talking to
yeah,
themselves, or
it's
do they have like a doula?
self-trained essentially. You just
Okay.
like Google it. They have a website, they have a bunch of videos and stuff on
Hmm.
YouTube. And there's now, when it first came out, it was like just it was smaller, but now it's kind of developed. And I've had some patients that maybe are more religious that do it kind of with with whatever their religion is
Yeah.
kind of slant, and some that are not at all religious and they do it,
Mhm.
like more with a spiritual but less religious kind of slant. So it has kind of developed
Yeah.
where it fits well for a lot of different people, you
Yeah.
know. And it's definitely hands down the most impressive method, I think, for people who do want to try to go. Or, certain people are not candidates for epidurals and would like to have one, but are not allowed to get them. And so
Mhm.
for them, it's really helpful too. But I've seen people who cannot tolerate just a regular exam in the office use this and do a beautiful unmedicated delivery with
Wow.
nothing. It's impressive.
And what are some reasons why, besides like an allergy or because
Mhm.
you're already too far in labor, what are some other reasons that you probably wouldn't do
Some
it?
people have had prior uh, back surgery that have
Okay.
hardware there, and so they can't do it. Some people have certain, back problems. Like if you already have problems with the discs and in
Mhm.
the levels that they would do an epidural, a lot of times they don't want to touch it because they don't want to make anything worse,
Mhm.
And then there are certain uh, conditions that can cause your blood not to clot properly.
Oh my God.
And if you have any of those, probably the most common would be some people, as a part of preeclampsia, can have their blood not clotting properly.
Okay.
Um, and so if your platelets are too low, or, you've been on a blood thinner
Mhm.
and we didn't know you were going into labor and take you off in time or something like that, then they won't do it because they're afraid to poke a hole
Yeah.
and then you bleed and don't stop bleeding,
Okay.
from there. So,
And then I know because I know how dangerous spinals can be, and I had one with
mhm.
my son, and now
Uh-huh.
I have this spot on my back that never stops itching. Like what caused?
Uh-huh. I don't know about the itching.
Right. Every time I got it, and it will never go away.
I don't know what that would have been. I don't know, unless they maybe just got, happened to get a little feeder nerve or something,
Mhm.
and that changed a little bit. A lot of times I think that I'll hear people saying that something wasn't the same after an epidural or spinal. And I think a lot of times it's more so the pregnancy that,
Yeah.
you know,
Okay.
that causes some anatomical changes to the back, or, all of that strain carrying that baby around
My son was huge. So
can change you forever. So
yeah, that makes yeah, he was 9.5 pounds. What is the difference between an epidural and a spinal exactly?
it depends on it's what space they're getting into.
Okay.
So it's a totally different space. It's like millimeters different in location,
Okay.
um, but it's a different space of the spinal cord, in which affects differently the nerves. And so a spinal will give you um, denser anesthesia. So it's good for a C-section because that's even more painful than a vaginal delivery would be. Um, but it's shorter lasting, so a good spinal is going to give you a couple hours.
Yeah.
of pain control. Whereas with an epidural, because of the space that they're in, they're able to leave a catheter in place and they can continue to give you more medicine over time. So a
Okay.
good epidural will last, maybe between 12 and 24 hours.
Okay.
So,
And so when you're delivering vaginally, they don't typically
mhm.
use a spinal. It's only an
Right.
epidural.
Yes.
Okay. Okay.
Yeah.
That makes a lot of sense. And I know I had placenta previa when I was
Yeah.
pregnant with my daughter. So
Uh-huh.
what exactly does that consist of?
So that happens when the placenta um, is covering the opening of the cervix.
Okay.
Um, and so, the placenta is what supplies the nourishment to the baby, and it does that by um, getting, you know, it's the interface of all the baby's blood vessels to all of the mom's blood vessels. And so it's a very bloody organ.
Okay.
Um, and normally, when you go into labor and the cervix starts to open up, there's nothing laying over the top of it. And so where the cervix opens up, there's just the bag of water and then the baby. And
Yeah.
once the cervix is open wide enough, then the baby's able to pass through there. But if the placenta is laying on top of the cervix and the cervix starts opening up, it tears that placenta apart
Oh,
as it's opening, and all of those blood vessels are then broken open,
okay.
and you can have like life-threatening hemorrhage essentially. During pregnancy, every single minute, so much blood is going towards the baby that a third of your blood volume goes through the uterus every minute. So it doesn't take long,
Yeah.
if that blood is not getting recirculated back through you, but is draining out, in a bleed, it wouldn't take long to die at all. So that's why someone who has a previa has to have a C-section.
Oh my gosh. So it would be more so fatal for the mom, but and the baby, or just
Potentially also for the baby. I mean,
okay.
essentially, basically also for the baby,
Oh my God.
because the
Yeah.
baby is dependent, while the baby is inside, the baby is dependent on the mom. So
Mhm.
if the mom runs out of blood,
Oh, I got
you
you.
know,
Okay.
then there's
Okay.
nothing taking oxygen to the baby anymore. So it would be a matter, typically you have, if the mom is dying, dead, you would have like 5 minutes,
Yeah.
where you could save the baby if you were able to get it out.
Yeah.
So,
Have you ever had to deal with that?
I, knock on wood, have not had to do like a perimortem C-section, but I've definitely, it's just been the luck of the draw. There have been, you know, my partners have had to do some,
Yeah.
so those are tough. But
Yeah. And what have you had any just horrible births that you had to do, or
I've had some,
yeah.
some tough outcomes and stuff. I think we forget, that just 100 years ago, it was very common for moms to die in childbirth, like I forget what the exact numbers are, but maybe 1 in 100,
Mhm.
like it was very common. Most people just 100 years ago would have known somebody who had died in childbirth,
Right.
personally. And now it's much less common.
Okay.
Um, and so it's not that it's not possible it's anymore. It's just that we have a lot of near misses.
Yeah.
And so those near misses can be um, traumatic, even though, you know, even
Yeah.
though we make it through, it can be very scary for everyone.
Okay. And as far as like prenatal vitamins, I know how
Mhm.
important they are during pregnancy, but what would be the best vitamin when you're not pregnant or right after, you've given birth?
Well, again, I'm not a very natural person.
Yeah. I
So I
know.
don't really, I wouldn't call myself the expert on vitamins,
Okay.
but in my opinion, I feel like, a multivitamin is
Okay.
basically a multivitamin, and
Hmm.
much beyond that is probably mostly marketing and not really necessarily a
Okay.
big difference from one versus the other. So I always tell people get the cheapest one,
Okay.
Um, I've had, it's controversial. There are some people that believe strongly in vitamins, and there are other people, I had one um, hematologist, which you would think, they're the blood doctors. You would think of anybody, they would be the most into it. And he was like, why are you taking vitamin? Like, stop doing that. It's just, he felt like you should eat a balanced diet, and
Hmm.
then you'll get a natural source of the vitamins,
Hmm.
and that all of this supplementation is not really the form in
Right.
which it's helpful for us, and
Yeah.
he actually felt like it contributed to weight gain, but
Oh,
I don't know if there's, you know, I don't know if that's true or not, but
okay. Yeah.
but there's a range of people, I think doing a multivitamin is probably unlikely to hurt anything and might help, but
Okay. And
especially
then,
for people who are not good at eating a balanced diet.
okay, good. And then I guess what would you say is a healthy weight gain for pregnancy?
It depends on what your starting weight is.
Okay.
So the smaller you are to begin with, the more weight that it's reasonable for you to gain.
Hmm.
And the heavier you are, the less weight is ideal for you to gain.
Okay.
So that people who are, in the heavier group, we usually say to try to keep the weight gain to 10 to 12 pounds or so.
Okay.
Um, uh, and as long as, we'd be following along the growth of the baby
Hmm.
during the pregnancy, as long as it seemed like the baby was growing well, even if you didn't gain weight, we wouldn't be worried.
Okay.
Um, but we usually tell people not to really diet per se during pregnancy in order to try to maintain that, but just to try to make some healthy choices and portion control. But some bodies are just gonna gain a lot of weight
Right.
regardless of what you're doing. Some of it is just genetic, it's gonna happen.
Okay.
uh, but
Okay.
for example, my first pregnancy, I gained 100 pounds,
Yeah.
and and then the second time, because that had happened and the baby came out 6 pounds.
Yeah.
That was so depressing. And
Yeah.
then I don't know what, I mean, obviously I wasn't going to have a 100-pound baby. I don't know
Right.
what my brain was thinking when it was happening, but um, yeah, when he was 6 pounds, I was like, oh God, what do I do now?
Oh my
But
goodness.
so then the next time I was very, very conscious about trying to limit the damage.
Yeah.
And even though and I think with the second one, I was sick in the beginning. So I had lost 30 pounds or something in the
Hmm.
beginning of the pregnancy. And even though I was very, very focused and stuck to a specific plan, I gained that 30 back and gained another 50. Isn't that
Yeah.
crazy? Like
Oh, yeah.
my body was not cooperative with the
Yeah.
pregnancy.
I definitely did. And with my daughter, I didn't gain that much, but I think with my son, I think I gained about like 85, 90
Oh
pounds.
my
Yeah.
gosh. Ay, ay, ay. Ugh,
I don't
just a
understand
nightmare.
it.
Just a nightmare. I get so jealous of these people that, bounce back too. Because some people will gain weight and then will just snap right back. And that was never me. I don't know. Um,
It's
it's
not.
not fair. You're supposed to, and I breastfed. You're supposed to lose weight when you're breastfeeding. Nope,
Yeah, I
not
didn't.
for me.
I did not lose weight at all. But I
Yeah.
know that is what. Now that you said breastfeeding, that was definitely one of the questions that some of these women wanted to ask.
Uh-huh.
Is, are children more? Are the children who aren't breastfed? Are they more
Hmm.
prone to illnesses than the children who are breastfed?
Um, technically, yeah,
Okay.
they are, you know, um, technically they're, in infancy, they are more prone to getting, ear infections or asthma, colds, that kind of thing. And I think in general, breastfed babies tend to have, they're less likely to be obese themselves.
Mhm.
Um, and there's a million things that technically maybe breastfed babies do better with. That being said, I'm a huge breastfeeding
Mhm.
fan. I breastfed both my kids exclusively for a year,
Mhm.
but but breastfeeding is also very challenging. And so I don't, as much as I'm a fan of the support that breastfeeding gets these days, I think it's also important to hold space for people who struggle with it, you
Yeah.
know, and recognize that realistically, I mean, you might have small improvements, and it's, of course, it's your baby. You want them to have every advantage possible. But
Yeah.
at the same time, the kids that are not breastfed do just fine. You know what I mean?
Yeah.
Like
Mhm.
formula, we're in a privileged society. Formula is safe and healthy, um, and how, as long as your baby is eating something,
Mhm.
how they get that food is such a small percentage of what you're providing that baby as a parent,
Yeah.
And so I don't like people to beat themselves up if
Yeah.
they're not able to do it,
Mhm. Yeah.
Uh, I don't think I think that's a negative outcome of the push towards breastfeeding, is that
Mhm.
some women feel really bad if it doesn't go well. And it can be very difficult to
It was.
get
It was for me.
established.
It
Yes.
and I'm kind of feeling a little defeated because I'm like, that was me. Maybe that's why my son
Yes.
had so many ear infections, and because I had a reduction. So me trying to produce it was
Yeah.
not happening, and it
Yeah. I
was
mean,
very
there's a million reasons that can make it difficult.
yeah,
And it's so your kids are not going to remember if they were breastfed or not.
yeah,
I suffered through a lot to try to breastfeed those kids, and
yeah.
they have no, you
Right.
know, zero recollection of it, and zero, my every shortcoming that they have, or you're gonna, as a mom, you're gonna find a way to blame yourself. It really doesn't,
Yeah,
you know
yeah,
probably nothing. My Every time my kids would act up, my ex would say it's because I got the epidural.
yeah,
Like, dude, this is not. Be like, if you didn't take that back crack, come
yeah,
on. Is not why they won't behave.
yeah. You didn't take that. Yeah, I don't know how some of the women do that voluntarily, and they say that they don't want because that is not that pain is no joke.
I
So
know it's serious. It is serious. That's for sure. And even I like to tell people that, too, even people who labor very well naturally, it's painful. Like,
yeah,
it's not that they're not in pain, it's that they have a unique gift to cope with it,
I
you
don't
know.
get it.
And I always tell men that are involved in those situations that this is not, don't, because she's making it look easy, do
Yeah,
not think that this is easy.
yeah. And I had two C-sections, so I never had to go through the ring of fire. And I'm like, thank
Right.
God, I did not want to have to ever.
Although C-section pain is no joke,
Yeah, it's not. Yeah, yeah,
it's,
that was not fun.
I would not, I've never had a C-section, but just looking at it,
Mhm.
I would take a ring of fire over a C-section any day, which
It
is, a lot of times the majority of people who have a C-section are not doing it by choice. It's because it
Yeah.
needs to happen.
Yeah.
But, it's not the easy way out by any stretch
Yeah.
of the imagination.
It definitely is not. And I lost a lot. I almost needed a blood transfusion with my son. I
Yeah.
was on a military base. It was like, what? No, I guess much rather
Yeah.
go to a civilian doctor.
Yeah. Yeah.
So,
Yes.
so,
Yeah.
and what's just one piece of advice, whether it be womanly advice, pregnancy, anything, just what would you give the listeners?
I would say, um, you know, women are half the population of the world. There's a lot of us. We are not one way. And so a lot of times people will say, oh, well, women do this, or women, they want to make us into one thing. And that's so far from the case. And so you should not, you know, if your experience is different from what maybe a lot of other people may have, that doesn't invalidate your experience at all.
Yeah.
And I think we should stop even striving to be like, well, her birth was like this, and I want my birth to be like that. It's not gonna be,
Yeah.
it's not gonna be, and it shouldn't be. And even if it was, you might not enjoy it as much as she did because you're not her. You know what I mean? And so I think people should be more flexible
Yeah.
to the idea of variation with childbirth, with the way that you parent, with the way that you move through life, and through all the different phases of womanhood. you know it's not it doesn't have to be one way. It doesn't make sense to be one way. Anyone who is trying to hold you to a different standard and say, oh, something must be wrong with your hormones because you have an attitude. No, you are doing something dumb. And that's why I have an attitude. You know what I mean? Like, this has nothing to do with my
Yeah.
hormones, and because men are also moody,
Yeah.
and that nobody tells them go get their hormones fixed, but
Right.
they have
Absolutely.
just as much attitude and mood
Yeah.
swings and unpredictability as we do. But yet, because we're women,
Yeah.
we're told we should fix that, and
Right.
it's just unreasonable.
Absolutely.
It's how I feel, and you're gonna have to figure it out
Yeah.
because
Just figure it.
like
Thank you from all women. Like we need to hear that because that is so
yes,
true. They're constantly just identifying us with that. It's like, oh,
right,
you guys are just so emotional. And it's like,
yeah,
you're right. So are they. They are
right,
too. Sometimes even more
absolutely,
than us.
exactly, right, yeah. And they don't have to explain to anybody about why. It
Yeah.
just is. And everybody assumes, oh, well, it must have been, something provoked them or something.
Yeah.
It's not a shortcoming on their part. It's just, yeah, it's that. So that's what I would say is that
Okay.
don't stop holding yourself to a certain goal, that is going to set you up for failure. Like, just try to accept, learn who you are, learn how your body works, accept who you are, try to maximize it from a health point of view, um, but not, you know, everyone is not going to fit one certain mold.
I like that. Thank you so much, cousin. Ah, just so beautiful and so smart. But
Uh,
again, everyone, again, this is my cousin, Nikki Rowan. And Nikki, so do you have your own private practice or?
no, I don't.
Okay.
So now that I'm doing this travel stuff, I'm just like I don't know, like I'm for hire, essentially,
Okay.
to
Okay.
the highest bidder.
Okay. I just wanted to be sure, so I didn't add that to the show notes. So, okay.
Yeah.
All
Yeah.
right. Well, again, thank you guys so much. Again, I'm Robin Black. This is Nikki Rowan. And this is It's All About Healing podcast. Everyone stay blessed.